Last month, a 58-year-old patient came to me. High blood pressure, stiff arteries. Doctor said he needed medication. I gave him a list. 5 Japanese foods. 3 months later, his arterial age dropped 12 years. No pills. Today, I will show you exactly what was on that list. But first, you need to understand why American arteries age faster than Japanese arteries. In my country, we have half the heart disease rate of United States. Half. And it is not genetics. My Japanese patients who moved to America developed same problems within 10 years. The difference is inflammation. Your arteries are like garden hose. When inflammation builds up inside, the hose becomes stiff, narrow. Blood cannot flow freely. You feel cold hands, tired legs, brain fog in afternoon. This is not normal aging. This is poor circulation crying for help. But Japanese elders in their 70s, 80s, have arteries 15 years younger than their calendar age. Here is why. 5 foods. Let me show you the first one. Number 1. Natto. Fermented soybeans. I know, it looks strange. Smells unusual. Texture is sticky. But in my family, we eat this every single morning for 70 years. Because natto contains natto kinase. This is enzyme that dissolves fibrin. Fibrin is protein that forms blood clots. Small clots block your circulation even when you do not feel them. Natto kinase breaks down these clots naturally, like small worker cleaning your pipes from inside. Studies show it works as well as aspirin for thinning blood. But it is food, not medication. How to eat. 1 small bowl in the morning. Mix with soy sauce, mustard, and rice. Start small. Half bowl if taste is too strong. Your palate will adapt within 2 weeks. That patient I mentioned, he started with natto 3 times per week. Now he eats it daily. But this next one is even simpler. You probably walked past it in grocery store 100 times. Number 2. Shiitake mushrooms. Not regular white mushrooms. Shiitake specifically. The brown ones with umbrella cap. These contain compound called artetanine. Very hard to pronounce. Very easy to understand what it does. Artetanine lowers LDL cholesterol, the bad kind that sticks to your artery walls. In Japan, we use dried shiitake in miso soup every morning. The drying process actually concentrates the nutrients. Fresh shiitake works too. Slice them thin. Add to any soup, stir-fry, or broth. Eat them 3 to 4 times per week minimum. Your liver will start producing less bad cholesterol naturally. One of my patients dropped his cholesterol 40 points in 3 months, just from adding shiitake to breakfast. His doctor was confused. Asked what medication he was taking. He said, mushroom soup. Now number 3. This one surprised even me when I first read the research. Wakame seaweed. The dark green ribbons you see in miso soup. Most Americans think seaweed is just decoration. In Japan, we know it is medicine. Wakame contains iodine and potassium. Both regulate blood pressure by helping kidneys release excess sodium. But here's the part that shocked researchers. Wakame also contains fucoxanthin. This compound literally tells your blood vessels to relax. Like gentle massage from inside. When vessels relax, blood pressure drops. Heart does not work so hard. Circulation improves everywhere. You can buy dried wakame in any Asian market. Soak in water 5 minutes. Add to salads, soups, or buy wakame salad already prepared. Sesame dressing. Eat as side dish 3 times per week. 1 tablespoon dried wakame gives you full day supply of iodine. Your thyroid needs this for metabolism. Better metabolism means less fat in blood. Less fat means cleaner arteries. Now the 4th food. This one is controversial in West, but essential in Japan. Green tea. Not the bottled kind with sugar. Real brewed green tea. Matcha or sencha, both work. Both contain catechins. Catechins are antioxidants that protect your artery lining from oxidative damage. Think of rust forming on metal. Oxidation does same thing to your blood vessels. Makes them stiff, brittle. Catechins stop this rust before it starts. Keep vessels flexible young. But here's what most people do not know. Green tea also relaxes blood vessels immediately. Within 30 minutes of drinking 1 cup, your arteries dilate. Blood flows easier. You feel warmer. In my practice, I tell patients drink 2 to 3 cups daily. Between meals, not with food. Why not with food? Because tannins in tea block iron absorption. Drink 1 hour before or after eating. Use water at 70 to 80 degrees Celsius. Not boiling. Boiling destroys catechins. Steep for 2 to 3 minutes. Longer makes it bitter, but does not add more benefit. That 58-year-old patient. He replaced morning coffee with matcha. Said his afternoon energy completely changed. No more crash at 3 p.m. No more cold hands at desk. Now the 5th food. This is secret of Okinawa centenarians, the people who live past 100 years with clear minds and strong hearts. Bitter melon. In Japanese, we call it goya. I will be honest, the taste is very bitter. Most Westerners hate it at first. But what it does for your blood sugar is remarkable. And blood sugar is everything for circulation. When blood sugar stays high, it damages artery lining. Like sandpaper rubbing inside your vessels every day. This damage attracts cholesterol. Cholesterol sticks to damaged areas. Plaque forms. Arteries narrow. Bitter melon contains compounds that act like natural insulin. Help cells absorb sugar from blood. Less sugar in blood means less damage. Less damage means cleaner arteries. Simple. In Okinawa, they eat goya, stir-fried with eggs and tofu, called goya chanpuru. The eggs and protein reduce bitterness. You can also find bitter melon tea or capsules. Start small. 1/4 cup twice per week. Let your taste adapt slowly. Your arteries do not care about taste. Now let me show you how to combine these 5 foods into simple daily practice. You do not need to eat all 5 every day. That would be overwhelming. In Japan, we follow a principle called hara hachi bu. Eat until 80% full. Same with these foods. Do 80%. Not perfect, just consistent. Here is my recommended schedule. Morning. 1 bowl natto with rice. 1 cup green tea. If natto is too difficult, start with miso soup with wakame and shiitake instead. Afternoon. 2nd cup of green tea. Between lunch and dinner. Dinner. Add shiitake to any meal. Soup. Stir-fry. Grilled. Does not matter. Twice per week, add bitter melon. Stir-fried or as tea. That is it. Simple. No complicated recipes. No expensive supplements. Now let me address common questions my patients ask. Question 1. What if I am on blood thinners, like warfarin? Very important. Natto can interact with warfarin. Talk to your doctor first. Do not stop medication without medical supervision. These foods work with medicine, not instead of medicine. Question 2. Can I buy supplements instead of eating actual foods? You can. Nattokinase supplements exist. Green tea extract exists. But whole foods contain hundreds of compounds that work together. Supplements give you 1 or 2. In traditional medicine, we call this synergy. The whole is greater than parts. My advice: try real foods first. If taste is impossible, then consider supplements. Question 3. How long before I see results? Most patients feel warmer hands and feet within 2 weeks. More energy within 1 month. Blood pressure improvements show up at 6 to 8 weeks. Cholesterol changes take 3 to 4 months. This is not quick fix. This is lifestyle. Remember that 58-year-old patient. His arterial age dropped 12 years in 3 months. But he was consistent. Every single day he followed this protocol. Question 4. Where do I buy these foods in America? Any Asian market will have Natto, Wakame, Shiitake, usually in refrigerated or dried section. Green tea you can find anywhere. Whole Foods, Trader Joe's, even regular supermarket. Bitter melon is harder. Asian or Indian markets usually have it fresh or frozen. If you cannot find fresh bitter melon, Amazon sells dried tea and supplements. Now, let me tell you what happened to that patient after 6 months. He came back for follow-up. His doctor ran full panel, lipids, blood pressure, inflammation markers. Everything improved. LDL cholesterol down 42 points. Blood pressure from 140/90 to 120/75. But most important, his C-reactive protein dropped from 8 to 2. C-reactive protein measures inflammation. High inflammation means high risk for heart attack, stroke. His inflammation was now in normal range, just from food. His Western doctor said, quote, "I do not know what you are doing, but keep doing it." That is power of traditional wisdom meeting modern science. But I must be honest with you about limitations. These 5 foods are not magic. They will not reverse 50 years of damage in 3 months. If you have severe blockage, you need medical intervention, stents, surgery, medication. These foods work best for prevention and early-stage problems. Mild high blood pressure, borderline cholesterol. They also work beautifully alongside medication, not replacing it. In Japan, we believe in both. Western medicine for crisis, Eastern wisdom for daily life. Now let me share 3 mistakes I see Americans make with these foods. Mistake 1. Buying sweetened green tea from bottle. This defeats entire purpose. Sugar causes inflammation. Green tea reduces inflammation. You cannot have both. Brew your own tea. No sugar. Maybe little lemon if you need flavor. Mistake 2. Eating natto once and giving up because of texture. Your palate needs time to adapt. In Japan, babies eat natto. They learn to love it. Try mixing with strong flavors first. Soy sauce, mustard, green onions, rice. After 2 weeks, your brain will stop fighting the stickiness. Trust the process. Mistake 3. Expecting instant results and quitting after 1 week. Your arteries did not become stiff overnight. They will not become flexible overnight. Give it 12 weeks minimum. Mark calendar. Commit to 3 months. After 3 months, get blood work done. See objective proof. Numbers do not lie. Now let me give you a bonus tip that makes everything work better. Walk after meals. Just 10 to 15 minutes. In Japan, we call this sanpo, post-meal walk. It helps blood sugar stay stable. When blood sugar stays stable, arteries stay clean. Foods work better. Everything compounds. Combine these 5 foods with gentle movement, and you have complete circulation protocol. This is how my grandparents lived to 97 and 94. Sharp minds, strong hearts. They never counted calories, never went to gym, just walked daily and ate these foods. Let me recap the 5 foods one more time so you remember. Number 1, natto. Dissolves clots naturally. Eat in morning with rice. Number 2, shiitake mushrooms. Lowers bad cholesterol. Add to soups 3 times per week. Number 3, wakame seaweed. Regulates blood pressure. Mix into salads or miso. Number 4, green tea. Protects arteries from oxidation. Drink 2 to 3 cups daily between meals. Number 5. Bitter melon. Controls blood sugar. Eat twice per week, stir-fried or as tea. Start with one food this week. Add second food next week. By month 3, all 5 become habit. Your arteries will thank you.